Articulator is now ready for mounting the face bow. Raise or remove the incisal guide pin so that it won't interfere with the upper member being placed on the crossbar of the face bow during the mounting procedure. Next, place the metal disc into the slot on the plastic mounting plate and attach the plate to the upper member. We can now attach the face bow to the articulator by means of the brass face bow mounting pins located along the side of the condylar element, making sure that the earpieces are pushed up against the side of the condylar element. Tighten the anterior face bow thumb screw and check to make sure that the side thumb screws are secure as well. Check to make sure that the upper member of the articulator will close down on the crossbar without any interferences. If you haven't done so already, slide the Nasion relator assembly out of the way. Many clinicians prefer to use a face bow fork support when mounting the maxillary cast to support the face bow fork during the mounting procedure. This is an optional piece, and as is demonstrated here, it is secured by means of the magnet. Next, the maxillary cast is positioned and is now ready for mounting. One additional note: the relationship of the maxillary cast to the maxillary member of the articulator with the face bow in place will not change during the mounting regardless of the angle, because this has been preset so that the axis orbital plane can be maintained through the entire mounting process of the maxillary cast. After the mounting stone on the maxillary cast has set, we can then proceed with mounting the mandibular cast. Invert the articulator. The articulator will be supported by the black knobs on top and the incisal guide pin. Open the articulator and place a mounting plate on the lower member of the articulator as shown. Inspect both maxillary and mandibular casts for nodules or other interferences. If interferences are present, remove them, being careful not to change the occlusal relationship. Next, place the interocclusal record on the maxillary cast. Carefully position the mandibular cast on the wax interocclusal record. There should be a very positive seat between the cast and the wax interocclusal record. If in fact there is any distortion or rocking motion, the interocclusal record should be considered inaccurate and remade. Check to make sure you have enough clearance between the base of the mandibular cast and the lower mounting surface of the articulator. If necessary, remove enough of the base of the mandibular cast to have room for the mounting stone. It is recommended that you place a gypsum separating medium on the base of the cast, usually in the indexed area. This will facilitate the easy separation of the cast if needed. As demonstrated here, we're using Vaseline as our separating medium. Mount the mandibular cast in the same fashion as the maxillary cast was mounted. When closing the mandibular member, again verify that there is full seat in the condylar elements and that the end of the incisal guide pin touching the plastic incisal guide table. Allow the mounting stone to set. It is not necessary to overfill the area on top of the cast with stone, as this will be added to at a later time once the mounting has been verified. Once the mounting stone has set, you can verify the accuracy of the mounting by using articulating paper and locating the same first contact on the cast as was identified by the patient. At this point, we need to evaluate for any slides or occlusal discrepancies. To do this, loosen the incisal guide pin screw, raise the pin, and temporarily retighten the screw. Unlock the centric latch, close the articulator to the first point of contact, making sure that the condylar elements are seated, and then close to the maximum intercuspal position. Watch for any sliding movement. The same slide that was produced in the patient clinically should be reproduced on the articulator if present. To set the protrusive guidance, remove the incisal guide pin and carefully place the protrusive record on the cast. Unlock the centric latch and carefully rotate the maxillary cast into the protrusive record. Carefully invert the articulator. Loosen both condylar guide elements by loosening the black clamp screw knobs. When loosening the clamp knobs, ensure that you keep them snug so that rotation of the condylar element is accomplished without losing the ability to control the rotation. Place the articulator upside down. Make sure that the protrusive record is fully seated, then check for space between the superior wall and the condylar element. If space is present, carefully rotate the condylar guide element up until it touches the condylar ball. It is recommended that you do this by both tactile and visual observation. Tighten the clamp knob on that side. Perform the same procedure on the opposite side and then tighten the clamp knob screw on that side as well. The use of the dental articulator truly can enhance your practice. From patient education and case acceptance to analyzing the occlusal scheme and constructing more predictable dental restorations, the articulator provides a valuable adjunct to your clinical practice. If you have further technical questions regarding the use of the Whip-Mix articulator, you can visit their website at www.whipmix.com, or you can contact them at their toll-free number 800-626-5651.